Arthrodesis, also known as artificial ankylosis, joint fusion, or syndesis. The uniting of two bones at a joint is typically completed through surgery. In simple terms, the orthopedic surgeon manually straightens out the damaged joint, removes the cartilage, and then stabilizes the bones so that they heal together. This is done to relieve intractable pain in a joint which cannot be managed by pain medication, splints, or other normally indicated treatments. Arthrodesis is used to treat joint fractures, arthritis, and other conditions that affect the mobility of a joint. The arthrodesis procedure fuses the bones of the joint and prevents movement in that joint. Joint replacement surgery substitutes an artificial joint for the damaged one. These replacement joints will have the same range of motion of natural joints, but artificial joints can also wear out quickly. Additional surgeries may be required in the future. For this reason, joint fusion is often a better and more permanent solution for joint pain. A vertebral interspace is the non-bony compartment between two adjacent vertebral bodies, which contains the intervertebral disc, and includes the nucleus pulposus, annulus fibrosus, and two cartilaginous end plates. A vertebral segment describes the basic constituent part into which the spine may be divided. It represents a single complete vertebral bone with its associated articular processes and laminae. Arthrodesis, interphalangeal joint, with or without internal fixation. Each additional interphalangeal joint with autograft includes obtaining graft. With autograft includes obtaining graft, each additional joint. The physician incises the overlying skin and dissects to the interphalangeal joint. The physician may use a wire to stabilize the joint until fusion is complete. The incision is sutured in layers and the hand is splinted. A graft is harvested from the distal radius or iliac crest and interposed between the bones to prevent movement. Arthrodesis, great toe, metatarsophalangeal joint. Interphalangeal joint. An incision is made over the metatarsophalangeal or interphalangeal joint. The incision is continued deep to the joint. A capsulotomy is performed. Parallel cuts are made on the two phalanges that constitute the joint. The physician places the cut bones together. Pins or screws hold the bones in the correct alignment. The wound is irrigated and closed. Arthrodesis, with extensor hall UCI's longest transfer to first metatarsal neck, great toe, interphalangeal joint, e.g., Jones type procedure. An incision is on the dorsal aspect of the great toe and distal first metatarsal. It is continued deep to the extensor hall UCI's longest tendon. The physician fuses the interphalangeal joint. Fixation devices hold the fusion in place for healing. The neck of the first metatarsal bone is identified dorsally. The extensor hall UCI's longest tendon is identified dorsally. The extensor hall UCI's longest tendon is attached to the metatarsal using any of a variety of fixation devices. The incision is irrigated and closed in layers. Arthrodesis, carpometacarpal joint, thumb, with or without internal fixation. With autograft, includes obtaining graft. Arthrodesis, carpometacarpal joint, digit, other than thumb, each. With autograft, includes obtaining graft. The physician fuses the carpo-metacarpal joint of a finger or the thumb. Internal or external fixation may be used. The physician incises the overlying skin and dissects to the carpo-metacarpal joint. The joint is fixated with a wire, screws, or plates. The incision is sutured in layers and the hand is splinted. If a graft is obtained, the physician harvests bone from the distal radius or iliac crest. The graft is interposed between the two bones to prevent movement and a wire is placed through the joint until fusion is complete. The incision is sutured in layers and the hand is splinted. Arthrodesis, pantalar. Pantalar arthrodesis is the fusion of the tibiotalar, subtalar, talonavicular, and calcaneocuboid joints. The physician fuses several joints in and around the ankle. It can be performed in one operation or in two separate surgeries. The capsule of each joint is opened, explored, and debrided. Osteotomies are performed. The physician utilizes a variety of internal fixation devices such as pins, wires, plates, or screws to connect the bones together across each joint. Arthrodesis triple. The physician fuses the talonavicular, the calcaneocuboid, and the subtalar, talocalcaneal, joints. Arthrodesis subtalar. The physician fuses the subtalar, talocalcaneal, joint. Arthrodesis, with tendon lengthening and advancement, midtarsal, tarsal, navicular cuneiform, e.g., Miller-type procedure. An incision is made over the medial aspect of the foot. This is carried to the tendon and ligaments. The physician creates an osteo-periosteal flap incorporating the tibial tendon and the ligaments. The navicular cuneiform and metatarsal cuneiform joints are opened. The surfaces of the joints are denuded of their articular cartilage. The physician utilizes fixation devices such as screws, pins, wires, or plates to hold the joints in position. The flap of ligaments and tendon together is passed forward beneath the anterior tibia and transplanted to the first cuneiform bone and the base of the first metatarsal bone. Friction devices are employed to hold the flap. The incision is irrigated and closed in layers. Arthrodesis, metacarpophalangeal joint, with or without internal fixation. With autograft, includes obtaining graft. The physician incises the overlying skin and dissects to the metacarpophalangeal joint. The physician may use a wire to stabilize the joint until fusion is complete. Bone is harvested from the distal radius or iliac crest and interposed between the two bones to prevent movement. The incision is sutured in layers and the hand is splinted. Arthrodesis, tibiofibular joint, proximal or distal. The physician makes an incision along the tibia and the periosteum is stripped distally to the level of the calcaneus. Using a saw, the physician cuts through the neck of talus to mobilize and remove the talus as one large fragment or morcellized fragments. With the talus gone, the calcaneus can be seen. The distal end of the tibia is removed perpendicular to the long axis of the tibia. The physician uses a saw to remove the dorsal calcaneus and to create a flat surface for the arthrodesis. The two flat surfaces of the distal tibia and dorsal calcaneus are brought together to establish a varus/valgus and dorsiflexion/plantar flexion alignment. A cut is made along the anterior tibia parallel to the cut made in the neck of the talus, which creates a flat surface for opposing the neck of the talus. The bone surfaces are deeply scaled to prepare for internal fixation. Kirschner wires are used to place the tibia and calcaneus in apposition. Using an anterior cruciate guide, a pin is guided from the calcaneus across the fusion site to the anterior cortex of the tibia. Once satisfactory fixation has been achieved, cannulated screws are placed through the neck of the talus into the tibia. The wound is closed over a drain and a dressing incorporating plaster splints is applied. Marcaine is instilled through the drain tube into the wound. Arthrodesis, symphysis pubis, including obtaining graft. The pubic symphysis is a secondary cartilaginous joint located between the left and right pubic bones near the midline of the body. The physician makes an incision overlying the symphysis pubis. Dissection is carried down to the joint. The physician may harvest a bone graft. The physician closes the surgically created graft donor site. Internal fixation is applied to the fusion with screws and/or plates. The incision is repaired in layers. Arthrodesis Knee, any technique. The physician makes a long incision along the inside of the patella. Bone cuts are made to flatten out the joint surfaces of the femur and tibia. A U-shaped groove is made on the underneath side of the patella and a corresponding one on the femur. The patella is placed into the femoral groove and secured with screws. The physician makes an incision overlying the iliac crest, harvests a graft, and closes the surgically created graft donor site. The bone graft is placed between the joint surfaces. An external fixator compresses the joint surfaces. The knee is typically fused in 10 to 15 degrees of flexion. The incision is closed with sutures, staples, and /or stri strips. Arthrodesis, elbow joint, local. The physician performs an arthrodesis of the elbow joint and makes a posterior longitudinal or posterolateral incision. If the physician does not use a bone graft, the triceps tendon is split and released from the olecranon. The joint capsule is incised to expose the radial head and neck, and the radial head is excised. A posterior and anterior synovectomy is performed. The physician trims the olecranon into a triangular shape with a saw. A triangular hole is created through the lower end of the humerus and the olecranon is inserted through this triangular hole. The physician places a bone screw obliquely through the humerus and into the ulna. The triceps tendon is repaired with sutures. The physician repairs the incision in layers and the elbow is immobilized in a long arm cast. If a bone graft is used, the physician prepares a bed for the graft in the posterior surface of the lower humerus. A cleft is formed in the upper part of the tip of the olecranon. If local autograft bone is used, it is harvested from the surrounding healthy bone and no separate incision is required. The autograft is fitted into the olecranon cleft and humeral bed. If allograft, donor, bone is used, it is fitted in the same manner. Arthrodesis, elbow joint, with autogenous graft, includes obtaining graft. An autogenous graft is harvested from the patient's upper tibia or iliac crest with an osteotome. The physician repairs the surgically created graft donor site. 1 or 2 screws are inserted through the graft and into the humerus to make it secure. Bone chips are packed into the humeral ulnar joint. The physician repairs the incision in layers with sutures. A long arm cast is applied with the elbow in approximately 90 degrees of flexion. Arthrodesis, ankle, open. The physician performs surgery on the ankle to fuse the ankle joint. The physician makes 2 or more incisions overlying the ankle joint, exposing the joint. The incisions are individually extended deep to the joint. The physician opens the joint through an arthrotomy incision. Tissue is dissected and debrided as necessary. The surfaces of the joint are prepared so that they can be fused together. Preparation includes debriding and smoothing so that an intimate fit can be accomplished. Numerous methods can be used to fuse the joint, including screws, plates, or external fixation devices. The physician irrigates the joint and closes the arthrotomy. The incisions are irrigated and closed in layers. A cast or brace is applied to hold the newly fused joint in place until the bones heal together.